Today I'm talking about adhesions or scar tissue as a source of pain. This can be separate from endometriosis or it can be in addition to endometriosis. It can be a result of endo. There's some controversy. I mean, it's interesting. If you talk to general surgeons, most of them do not believe that adhesions cause pain. And not all adhesions cause pain, but they can. And as an example, back way when I was first starting practice, one of the physicians that helped me was an older gentleman who had actually been practicing since, I believe, the 1930s or so. He'd been around for a while. And we were doing a conscious pain mapping, which is where we use a little miniature laparoscope with the patient awake and poke around inside to try to reproduce the pain. And the patient doesn't know where I am, so I can kind of do it blinded, push on different areas, come back to it, double check it, make sure we get the same response. And with this patient, he was watching, and with this patient, every time I tugged on the adhesions, she said, that's the pain. And we did that several times when she didn't know where we were poking around. And afterwards, he looked at me and he said, here all this time, I never thought that adhesions cause pain, but I can see I'm wrong. And great guy, great surgeon. But again, you develop your preconceived notions. So they can, and it is part of the pain syndrome in some patients. And often the patients know. They'll say where the pain is, and you look and there's scar tissue or adhesions there, especially the ovaries. Again, as I've said, for the guys, if we stapled or sewed your testicle to your leg and we went jogging, would that hurt? Yeah, I think most of us would not be interested in participating in that. So if a woman's ovaries are scarred down into the bowel or tugging and pulling, then it can be the same kind of pain. Now, there's three basic types of adhesions. There's filmy adhesions, which are kind of like spider webs, and quite frankly, those probably don't cause pain, because if there's enough tension on it, then they would break. There's not much strength to it. Then there's what's called vascular adhesions, which where there's kind of a string or a rope that's connecting two things that aren't supposed to be connected. And again, we need to take that scar tissue out. And then there can be dense cohesive adhesions where and effectively they're glued together. Two things are stuck together. And so those are the basic types of adhesions. And then there's what I call fibrosis. So the peritoneum, the inside lining of the pelvis, is supposed to be thin like saran wrap, and you should be able to see through it. And it can get to be sinewy or thick like belt leather, and just that itself can bind and pull on the nerves and cause pain. And so, and the other kind of misconception out there is once adhesions, always adhesions don't operate, going to make them worse. And again, I think it comes down to surgical technique, and probably more important with adhesions than just about anything else. Because in my experience, I on average, kind of typical to be expected results, we see about a 50% reduction each time we do surgery. And I think that it comes down to a variety of different things, but the biggest thing is really being very gentle with the tissue and being very aware of any damage, thermal damage, the burning, where you get collateral spread of the heat and necrosis dying off of the tissue doesn't help. If the tissue's dry, we need to keep it moist. We need to be careful mechanical injury also. And then adhesion barriers, I think, do help if you're dry, if you're not having using and that kind of thing. So it is possible to treat adhesions. It is possible to get rid of them. Sometimes it takes more than one surgery to do that. But at the time of surgery looking for endometriosis, it's also important to look for adhesions or scar tissue and to address them. And then really won't go into today. Once in a while, I don't do it a lot, but there is what's known as an early second look laparoscopy. And I'll talk about that separately, but that's a different tool and the really bad adhesion cases that we have that can potentially help as far as getting rid of adhesions. All right, so basic overview, but one other thing in patients with pelvic pain, that can be present in addition to the endometriosis.